Are you having a great time?
I'm having a terrific time. You guys can go ahead and head out, and I'll take a nap now.
Okay. Hi, my name is Tanisha. I'm a chiropractic assistant here at Kalkstein Chiropractic, and I'm here with
Jayla, another CA.
Yes. And today we're going to be doing some heat and stem on her low back. So we're just going to get right into it. So before we put people on heat and stem for their low back, or just in general, we put this bolster under their feet. If you could go ahead and lift that up for me, put that down. Thank you. It's just to alleviate that pressure on the low back. Do you mind?
Oh, laying down? Okay.
Yes.
I'm just gonna.
Thank you.
You're welcome.
I'm gonna pull this up. Is that okay?
That is okay.
All right.
Probably should have helped you there. Sorry.
Yeah, just a tad, but it's okay. No hard feelings. So here we have our stem unit, and it basically just sends electrical currents to the soft tissue or muscle spasms to help relax them. So I'm just going to place this here.
Ooh, those are cold.
They're a little cold. Yeah.
Right there.
Right. I'm gonna pull these, and because this is one zone, we're gonna be doing an IFC setup. So we're gonna put these like this. You want the same color to be on the opposite side of each other. Do the same thing with this black one here. Perfect. All right. Before I turn on the machine, I'm just gonna put some heat on her back. We also do ice, but it depends on the patient and what their particular injury is. How's that?
It's terrific.
Great. I'm gonna go ahead and turn the stem unit on, and I'm gonna press IFC, and I'm gonna turn it up so it's strong but comfortable. So strong enough that she feels the muscle jumping, but comfortable enough that she can tolerate it for 10 minutes. You ready?
Yes. Oh, I feel it now. That's good.
That's good? Okay. All right, start it.
It's like tingly. But it
Very
feels
tingly.
nice. And the heat definitely helps calm everything down. Thoroughly enjoy this.
Great. I love heat and stem. It's probably one of my favorite modalities.
Yeah, it's the first time of me having this.
Yeah.
We call this the spa treatment here.
Yes. Very relaxing. Most patients love this, especially after their adjustments. They will come in here and go to sleep immediately.
Yeah.
It's great.
A nice little 10-minute nap before they
it's a
take on the
perfect
day.
10-minute nap. Pretty
So
great.
it's not like Shockwave where you want it to be a little painful?
Yeah, no, this shouldn't be painful. It should be, if anything, it should be relaxing. Of course, you'll feel the muscle jumping, but it shouldn't be so strong that it's uncomfortable for you.
Yeah, this more is like a constant sensation, more so, rather than like constant pain.
Yeah.
Nice and tingly. And then like kind of as the 10 minutes go on, it kind of dulls down a little bit.
Yeah.
But the heat does take over.
Are you having a great time?
I'm having a terrific time. You guys
I'm
can
so
go ahead
happy
and
for her,
head out,
honestly.
and I'll take a nap now.
Okay. Well, that's it. All right. How was that?
That was amazing.
I'm sure. I'm glad it was.
Oof.
Let me go ahead and take her off of that. Just gonna pull these here. Patients can purchase their own stem pads, or they can use the ones that we provide, but we change them out every week, so don't worry.
Oh, that was just amazing.
Relaxing, ain't it?
Yeah, it feels like my back has calmed down. It's kind of similar to the laser that we have. It helps
Yeah.
reduce like inflammation and calm down your muscles. But this is nice with the heat. That moist heat is a lot different than just using a hot heating pad at home.
Yeah.
Well, thank you, Tanisha.
Of course. I'm so happy to do that for you.
Everybody's Dr. Warren here at Kalkstein Chiropractic. I'm with Eddie. Eddie's dealing with some disc pain coming from his lower back. He came in 3 days ago. Just really locked up, kink in his lower back, pain referring into his hip here. I saw Eddie. Eddie, how long ago was that when you first came in?
About a year, 2 years ago.
2 years ago. Came in for a couple sessions. Similar problem. You kind of got fixed up pretty quick, and then I hadn't seen you since then. And when did this kind of start?
It started kind of re-aggravated about 2 weeks ago.
2 weeks. What caused it?
Well, some years ago, I was lifting television. Something heavy.
That was the original injury.
Yeah, and then it kind of bothered me then, but it kind of went away for a couple of years and just recently coming back. So something re-aggravated it, or stop on the exercise. We'll further tone.
It's the back stretches that we gave you kind of back in the year or two ago. That helped you out a little bit, just staying mobile in general.
Yes.
You came with right side lower back pain, referring down. You had a positive slump test. You had some compression tests that were positive. You didn't have any neurological weakness or anything along those lines in terms of his extremities. Didn't have weakness in his foot. Didn't have weakness in any of his other muscle groups higher up. But we're looking for some of that foot drop sometimes with this type of a problem. Not the case. Neural tension for sure. In the form of the slump test. Palpatory pain on that right side. Here's, you kind of look, Carly, here's his 12th rib coming right down through here. So if you kind of draw a line like this, and a line like this, that muscle sits right through this window here, and you'll feel this right there as a trigger point on you. So that muscle guarding around that irritation in that nerve. And we're gonna get to that in just a second. So through the examination, saw him 2 days ago. I've seen him twice. This is my third time seeing him. Seeing him daily this week, and then we'll back off next week because he's already feeling a ton better. Not getting any of that pain in the hip. He's moving better. The biggest thing for him is waking up, and he's just feeling so locked up, can't get out of bed. It's a process to get out of bed. That stopped happening this morning, and I decided, hey, come see me a couple times in a row. I'll keep it moving well, and I'll adjust you. I'll do some soft tissue work, and his back is tolerant enough for me to be putting him on dry needling here for this, as well as traction, lumbar decompression. So he's getting his back stretched. He's getting dry needling done. I'm doing hip flex here, soft tissue work, and I'm adjusting his mid and lower back. And once his pain is under control, then we'll get he's already really active. Just you can see he's pretty strong. So it's not like I need to build up muscle on him. If anything, just focus on the day-to-day mobility work that you're doing, and just to get on top of some of the stiffness that kind of started to creep up on you. You know what I mean?
Mm-hmm. Yeah.
Is that fair to say?
That's fair to say. Yes, sir.
Can't say I haven't been in the same boat myself, brother.
Yeah. It's a challenge.
Can't be. You got 6, I got 3. I think you win on that battle.
Yeah. It's a battle.
It's a good battle.
Good
I'm grateful
battle.
to be a part of it. That's right. Yeah, I think we feel the same way about that.
It's definitely a good battle.
That's it. So funny. It was hilarious last night. It was a circus around us. I'm sure you know exactly what I'm talking about.
Yeah.
My 2-year-old, she's my middle child.
Oh, wow.
And she'll run around or she'll sneak up behind you. She'll like pinch the back of your calf and then run away.
Oh, okay.
I'm like, what are you doing? And she'll smile around the corner.
Peekaboo.
She's picking on her older sister too. It's hilarious.
Yeah, it's cute.
That's cute, man. You probably feel those a little bit more. These two on the outside, and I can kind of see the little indent in the needle itself. When I get into like a tighter tissue, it'll create a little dimple around the needle itself. Your low back feels and looked pretty good on the right side, down where we were kind of working in this area.
Yeah.
It shouldn't hurt as much in terms of some of the needles that I did, or feel as sensitive is probably a better way of putting it. Low pressure.
Just a little.
Yeah. That's right with it. I don't want to be this. Okay, I'm gonna put some stim on this side. You've had your traction already,
Yeah.
and then I'll bring you into a room after this. We'll get you loosened up through some adjustments, and then we'll go from there. All right?
Sounds good, Doc. Sure.
Frequency around 4.3. Do a low frequency. This is a great tool with dry needling with stim. You have multiple channels going at the same time. It's very reliable. Japanese made. So we're gonna go through channels 1 and 2. You're gonna feel them both on the same side. It's gonna kind of feel it together. Strong but comfortable, okay, Eddie?
Okay.
Let me know when you start to feel it. I'll be able to see it on the needles first too, which kind of helps me know when I kind of reach that level that goes beyond that contraction of the tissues. Is that okay? Is that too strong?
Yeah, just a little, just a tad bit.
I'll back it off. All good. How's that?
Just a little more. Yeah, that's perfect, Doc.
Good right there?
Yeah.
Alright.
That's perfect.
And you're going to feel one a little bit closer to the spine. Let me know when that one's good for you.
Okay. Yeah, that's perfect.
Okay, I'm going to back it off a little because it's going to get stronger while you lay here.
Okay.
I can change it again. Is that better? Is that good for you right now where it stands?
Yep, that's good.
Alright, you'll be here for a couple minutes, okay? Come back and pull this off for you and then we'll get you into a room, alright?
Hello, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor plus. And I'm with Dave again. You started with this, what? Let me cheat. November, the middle of November, right?
Right.
And Dave came in with low back pain,
My back pain,
pain down the left leg,
and numbness in my feet.
and weakness in
Oh,
that
right.
left foot. Remember that? Yeah,
Yeah.
yeah. And here we are. This is his 13th visit, so 12 visits into this thing, right? And you went to see your primary pain management doctor. He didn't want to do any injections at all,
Correct.
which
He suggested PT and gabapentin.
a gabapentin.
Pentin.
Yep. Been a pain client in the past, so you decided to come here instead of go to PT, right? Which was,
Exactly.
yeah. And I'm slightly biased. Smart move on his part. Okay. So here we are, 12 visits. Overall, how much has the pain decreased by? 50, 60, 70, 80?
Like 80, 85.
80, 85.
85%.
Okay, yeah. And the journey was you would come in, we would do decompression
Yeah.
to your low back, traction, if you will,
Traction.
right? Traction, okay.
I think I had 8 sessions of
Yep,
traction.
yep, because then he was doing so well, we stopped the traction and we went then to, when we were doing the traction, we were doing something called McKenzie.
Oh, the McKenzie.
And which
yes.
way were you moving, forward or backwards?
Forward.
You were forward preference, is that right? Okay. And after we made so much improvement, we dropped the decompression / traction and we started to add in
The
what?
PT. You called it something, I don't remember.
Core stability.
Core stability.
Yeah.
Right.
Functional, foundations, core stability. So because he was making so much improvement, he was getting some muscle strength back, and we would check it after we would adjust him. And the muscle was starting to get that impulse from the nerve. He's doing much better, so we started to work on creating stability in his core through exercises. We continue to do the McKenzie, and his home exercises would do the ones he could do at home and the McKenzie. That is the core foundation and McKenzie, right?
Mm-hmm.
So 85% less pain. And he's done so well that we're transitioning from the foundations program into something we call Get Stronger, Smarter, or our functional strength program, because Dave's objectives were to get out of pain, get strength back.
Strength.
But overall, your fitness goals were what?
Strength and stability and reduce this.
So, and the exercise isn't going to reduce this.
Right.
But we talk about nutrition, whole foods nutrition, right? And when the boss gets back in the new year, we're going to try to get Dave up to see my wife Megan, who has her master's in nutrition, and she's what they call as a functional medicine coach. They're using food to help improve the individuals. In your case, your metabolic health, right?
Okay.
So, and I say to people, there are 5 things that you should focus on. One of those is sleep. The second one is movement. The third one is how you fuel your body. Then we talk about how you manage stress, and then a sense of purpose. And I think I like the top 3 for most people. Some people we've got to work on that stress and a little bit more than others. But I think if you put energy and effort into the top 3, you begin to transform your life. And that's the journey that Dave is going to start with us here in the new year. And because he's gotten out of this pain so nicely, it's impressive, Dave, to be honest with you. The fact that you were able to have the pain decrease and getting muscle strength back, yeah. But we're transitioning. The adjustments will be part of it, but really we're shifting to having him be more responsible for his results, right? Because they're your goals, not the practice goals, right? We're just going to facilitate. Let's have you bend to the right for me. Lightly bend. Any discomfort?
Tightness.
Don't bend that knee down. Keep that knee down. Tightness on what side?
Right in the middle.
Right in the middle. Now go back to the other side. So he's still a little restricted towards the end, that side. Do you feel any pressure, more pressure when you still go that way?
Yeah.
Yeah, okay. Arch backwards. Okay. Any discomfort?
No.
It's much better. Just try to touch your toes for everybody once.
That's way better.
Yeah, that's way better. And what was it? Could you stand on your toes, or was it you couldn't walk on your heels? Which one was it?
It was primarily the numbness in both feet.
Yeah, but what movement could you do? I had you either
Oh,
walk
that-
on your heels, or I had you get up on your toes. Which one was it?
Toes, I'm okay.
Yeah, try to go up on your heel for me now. Yeah.
Okay.
Go ahead and turn sideways that way and hold on to the wall a little bit. Go up on your toes. I'm on your heels, I'm sorry. Hold that for me. Be strong. This one. Oh, that's good, Dave. Okay.
Better?
That's terrific. It's terrific. So let's go left side down, right side up. So he's not completely out of the woods, but I think you can see the light, can't you?
Absolutely.
If you're looking to get out of pain, because the pain is stopping you from being able to play golf, play with your grandchildren, right?
Yeah.
Even do daily activities, right? So for some people, it's just getting them out of pain. That's the first objective, right? But other people who don't have a lot of pain, the next thing is they want to change their life in the sense of movement, because they want to be able to keep doing what they've been doing 5 years, 10 years, 15 years from now.
Yes.
So that's a little bit different kind of objective, and the way you get there is differently. That's our Get Stronger, Smarter, or our Functional Strength program. I want you to relax for me. Get that nice sentence for me. Let it go. Very nice, Dave. On your back.
Oh, we're flipping over.
Yeah, I'm gonna make it easier on you rather than second turn. Just on your side towards me.
Yeah.
You know, I've been using these tables for
A long time.
accounting chiropractic school for like 40 years. And I tell you that what's really nice is before they were manual, you know, they were so bad that chiropractors were killing themselves trying to lift, raise and lower patients. Now I press a button, you know, and before you have to manage the table, open and make it longer, whatever was all manual. Now you press a button and it's just gorgeous, right? So it is state-of-the-art adjusting tables, right?
Yes. Mm.
Make that loose for me. Now, I want you to take a deep breath in. Let it go. Let this leg just drop away from you. That away, on your back. That's beautiful. You know, breathing is part of getting adjusted. I think learning how to breathe correctly, diaphragmatic breathing, deep belly breathing is really important. It's one of the tools we use with helping people sleep. And I got to give Dr. Andrew Wee, or probably who knows before him, credit for that, but it's really helpful. It's a way you can start to control your parasympathetic, the way you control your autonomic nervous system, the parasympathetic side. Go ahead, step off for me now. Bend to the right towards me. Keep that leg straight. That's much better. Now, this is the one I'm really looking for. Go this way. Left.
Keep that leg.
Yeah.
Better.
That's better, yeah, for sure. It's less pressure too, right?
Oh, yeah.
Anything else you want to share with us?
Highly recommend them.
Yeah, awesome. So if you or anyone you know is suffering from musculoskeletal pain, whether it's the neck, the low back, headaches, or you're looking for a transformational program where you learn how to get stronger, smarter under a doctor's supervision, let us know. So again, Dr. Jeff Kalkstein, your Baltimore area chiropractor. Thanks, Dave.
Thanks.
So we're back again. So I adjusted Dave's neck, and Dave says to me, what?
It's much better.
Yeah, because your neck was, what, stiff, tight? Yeah.
I can almost get all the way around.
Yeah. Compared to, that's significantly
yeah.
better, yeah. And oh, by the way, this is where we do the transformation of all the functional strength program and what we do the Get Stronger, Smarter program, right? And this is the environment that Dave is going to be moving into heavily next in the new year. Very good. Thank you, Dave.
Thank you.
Thank you.
Hey everybody, it's Mike here from Kalkstein Chiropractic, here to announce an exciting partnership with Bob and Brad here in the office. We're super excited about it. Like you guys all know from our YouTube channels and our videos, we love doing heat and stim. We love doing hot therapy, hot moist therapy especially. So one thing that we're doing today is we are talking about our Bob and Brad heating pad. So we've got Eddie here today. Eddie is about to get some therapy on his low back, so what better way than to break in our new heating pad from Bob and Brad. One of the really cool features of this heating pad is it has a remote. The remote actually goes in 30-minute time increments, like you can see. It also lets you control the heat of the product itself. It's a really great product. We're really enjoying it. The quality is awesome. Even with the fabric here itself, you can actually even spray water onto it, so you can get a little bit deeper of penetration with that heat, as opposed to just dry heat. You can add in that moist heat layer. Like I said, it's a really great product. We're really excited to have it here in the office. And come on in, guys, if you want to check it out or if you want to see their stuff in action. Hey everybody, it's Mike from Kalkstein Chiropractic. got Eddie here with us, and this is part 2 of our Bob and Brad video. So like you heard in the previous section, Eddie's got a little bit of low back muscle spasms going on. Been treating a lot of patients here this morning, so we're giving him a little bit of relief. First section we did the heating pad from Bob and Brad. We had a little bit of moisture on there as well, so we're getting that nice moist heat penetrating a little bit deeper than, you know, just the regular heating pad. So now we're going to go ahead and get him some ultrasound and stim. Really get those muscle spasms calmed down just a little bit for him. Alright, so we'll have a nice fun video here too, because like you guys know, with the ultrasound and stim, we get those nice muscle twitch responses. So Eddie, just let us know when the stim there starts feeling strong but comfortable, okay?
Mm-hmm.
I can see him moving on the table a little bit already. You starting to feel it, Eddie?
Oh yeah.
Perfect.
That's perfect right there.
Right there?
Yes, sir.
Okay. So we've got our grounding wire right there, so you'll notice as we get a little closer to that spot, some of those twitches will kind of pop up a little bit more.
Oh, yeah.
He's dancing around the table just a little bit. The ultrasound and stim is a very interesting feeling. It's a nice combination between ultrasound itself and then obviously the stim, but from what I find is you get a little bit more of that muscle twitch response. You can kind of see he's got a little bit of just shaking sensation going on here in the low back, a little bit in the QLs. There's some nice spinning there. Eddie's really fighting the beast for us right now. You can tell he's trying to be tough with the stim. So anyways, while we're joking around and saying that twitching and the responses are uncomfortable, they actually do help with the muscle spasms that he's getting going on right now in the back. So this will be a short little treatment, about 5 minutes long, and then afterwards we'll get Eddie out to the exercise floor. We'll have Eddie doing some therapeutic movement, really restoring movement into the low back, get him going through some extensions, and just really getting the back moving the way it should. In our case here at the office, we kind of spend a lot of time in that flexion position because we're bending over patients, and so that's essentially what Eddie needs to kind of work himself out of. He needs to restore himself with a little bit of extension-based exercise. So this is Eddie's first time getting ultrasound and stim. What do you think, Eddie?
Yeah, it's pretty interesting. I mean, I'm trying to like fight myself not to like jolt around.
Trying your hardest to relax.
Yeah.
But at the same time, it feels pretty good, right?
Right. Can't complain.
Yeah, this is definitely a good coupling modality if you're getting muscle spasms. If you're just having some acute pain, it's really good to kind of calm everything down. Alright, well, we are almost done with the ultrasound and stim here. Like I said, coming up next, we'll have Eddie going through some exercises, restoring that movement in the plane that he's kind of been neglecting today, and then we'll get him into a doctor's office, or a doctor's room rather. We'll get him an adjustment, and we'll get out of here. Everybody, we will see you on the next round, and once again, thanks Bob and Brad for the great products.
Thanks, Bob. Thanks, Bob. Oh, what? Thanks, Brad.
Hey everybody, this is Dr. Brady and I'm here with Bella, and today we are talking about Bella's low back and hips, right?
Yeah.
Okay, so Bella, kind of take us through on what's going on.
Yeah, so my activity's been increased. I've been hitting the slopes like every weekend, and then I've been lifting more. So I'm having some low back pain with extension and flexion.
Okay.
And then my hips, they've just been super tight. Like I've been feeling it in my psoas when I run, and then I'm feeling it when I lift. Like just the hip hinging movements have been pretty aggravating for me.
So is it something like during the activity of snowboarding it bothers you, or is it like the next day type thing?
It's during.
During.
It's been during.
Okay,
yeah.
Gotcha. So let's start with the low back here. Right now I'm going to go ahead and just do a quick range of motion screening just to see where we're limited here. So go ahead, Bella, and bend over and touch those toes there for me.
I can't touch now.
Now, is that all hamstrings, or are you feeling it?
I feel
pull in
it
the low
here.
back? You do. Okay.
I feel it
Does
here.
it go into the glutes at all, or does it stay pretty high?
A little bit.
A little bit.
Like a
Okay.
little bit. And if I were to like push to touch my toes, then it really pulls into the glutes.
Okay. A side in particular that's worse, or is it pretty much bilateral, the same
Pretty
as far as
even.
intensity? Okay.
It's pretty even.
Good. All right, and then lastly, just go ahead and go side to side for me. Let me know if you experience any pain or discomfort.
A little bit. More on the left side, actually.
Okay. So when you're going to the left there, are you feeling it more on the right or the left?
I feel it here.
Okay. When you're
I
going to
feel
the
it
left, does it
pull.
feel like a compression, or how would you describe it?
A compression.
Okay.
Yeah.
So go ahead and give me a big old hug there, Bella. Yep, just like that. You're going to bend backwards over my hand here. I want you to dip this shoulder. I'm going to load that joint. Is that painful for you?
A little bit.
And same thing through here. Any
Not
pain or
as
discomfort? Okay, good. And when I add that compression, does it radiate into the glutes at all, or does it stay pretty focal to
No.
that area?
It's pretty much like right here.
Okay. All right, fellas. So let's go ahead and go face down here for me, please. All right, how many scorpions did you do? You have any scorpions where the snowboard comes behind the head?
I had a couple. I did.
You hit any rails or anything?
I
At the
did
park?
actually.
Did you? Well, first, before I do any adjusting, I'm just kind of assessing the hips here. When I'm in this position right through here, Bella, is that painful at all, or does it feel just like a stretch?
Pulls to the front.
Pulls to the front?
Like I can feel it in like rolling kind of.
Okay. And same thing with this side. Let me know if you have any pain or discomfort.
No.
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 Pretty much everything is left-sided here.
I guess.
Okay. I'm just going to do one more test here. I'm just going to check the SI joint. So I'm going to block your pelvis and SI here, and then I'm going to lift this leg up. Does that cause any pain or discomfort?
No.
It does? If 10 is the most intense, what are we talking here?
Oh, like a 6.
6? Okay. Okay. So nice deep breath in here for me. All the way out. Nice and loose. Yep. Good. All right, so I'm going to do a few drops on that left SI joint here. Good. And if you could flip on over here for me, please. Without
I
falling.
almost fell off.
Nice. We actually can put it back here. That's a nice deep breath in, all the way out. Yep. Good. One more. Good. And same thing on the other side for me.
You lost your arms, honey.
Oh no.
Kabla.
Good. Nice deep breath in, all the way out. Just it. Good. And then on your back here for me, please.
Nice and crunchy.
So it's been a pretty good year so far, right, for snowboarding? You had like a couple weeks.
Oh, well, got a little warm, and that wasn't fun.
Oh, okay.
The slopes have been good.
That's
like
good.
The snow on the actual mountain's been good.
Are you going to Colorado this year at all?
Yeah.
When?
Feb.
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 Any pain or discomfort in the front of the hip while I do this here?
Yeah.
Okay.
I was thinking it was the right side, but I guess it really is the left.
Yeah, everything so far has been pointing left-sided.
Darn.
Any pain or discomfort there?
A little bit. It's that same, like...
Same spot. So I'm just going to bring it up a little bit. Still done okay.
Here. That's a good stretch.
That's a good stretch.
That's a good stretch.
You know some hip flexor stretches? Okay.
I did some this morning.
Good. So that's the biggest thing. And then just looking at your form and making sure, do you ride like both sides or like conventional? Okay.
Yeah. I make sure I switch it up.
Good. And then how about when you're on the lift? Like one foot in is always your...
It's always my left, yeah.
Your left foot's always in.
So that's probably why
Okay.
it pulls.
That's another thing I would look at and just kind of switch it up if you
Switch
can.
it?
I know you're used to that
I can
side,
switch
but...
it.
Oh man, Bella, you're usually like really flexible, but
hammies. I've been
I'm not.
lifting.
This is pretty good, but for you, it's a little. Yeah. You still doing the 75 hard?
Burrito. Oh yeah.
Yeah, nice.
I'm turning into a swole little munchkin.
What's been the hardest thing so far for you?
Fitting both of the workouts in and having enough time to eat 3 meals a day.
Yeah.
Like hitting my calorie thing.
You still on that high protein diet?
Yeah.
Doing shakes still?
Mm-hmm.
Or whole? Okay.
I'm trying
good.
to do like 3,000 calories a day.
3,000. Wow.
It's a lot of food.
It is. And then for right here, right now I'm adjusting Bella's hip. So the reason why I don't do it straight on, it's more of an open pack position, so it's easier for that hip joint, the acetabulum and the femur for the adjustment there. Good. Easier to move.
Probably got that.
And same thing with this left side, nice and loose there. Good. Wiggle your nose. Good. How's the reading been so far?
Oh, the reading's nothing.
10 pages a day?
Reading is nothing.
Now, do you count your school reading at all?
No.
Does that count?
No.
Okay.
No, I've been good.
Drop it a little bit lower. Good. Same thing through here. Good. One more. Good.
Yummy.
Is that gonna fall off?
No.
Clipped on?
Put it back.
All right, good. And then do those same motions there for me. So we're bending over.
Oh, much better.
Good. Side to side for me.
Still a little bit, but not as bad.
Okay.
And then there's nothing over here.
Still pinching when you go to the left?
Mm-hmm.
Okay.
Just a smidge.
Gotcha. All right, well, this is actually perfect. So I can show you the muscle work. If it's still kind of sticky there, especially with her, it's not real centralized here. She's kind of pointing out to the side. That tells me that there's probably a muscular component too. Oh, so go ahead and have a seat right here facing that blue wall. And we've done these before here, Bella, but you're gonna go like this is your neutral starting position, bending to the right, and then bringing that arm up over top.
These are really fun.
They are fun.
We did this to Kaylee yesterday.
That's right.
Yeah.
Yep. You guys keep injuring yourselves.
That's why we work here. Feel my back sweat?
It's hot in here. All right, so go ahead and bend to the right there for me. And then as far as you can. Good. All right, so working that QL, so from like the 12th rib here down to the rib cage, all the way down to that PSIS or the pelvis there. So go ahead and restart there, Bella. Sorry, I got distracted. It's on the camera. So here, I'm adding that compression. As Bella's going, it's lengthening that muscle. I'm adding the compression. She's doing great. And then back. Can you give me 2 more?
Yeah.
And then we'll recheck here.
Yeah.
Yep.
I'll give you as many as you need.
Good. And then 1 more here for me, Bella.
That's a good spot.
It is.
Get on in there.
Good. Okay. Now go ahead and stand on up. And then for the camera, show those side-to-side bends.
Oh, man. I had to think about that for a sec. Oh, that's better.
Better there. Good.
Thank you.
Yeah. Same thing on the other side there. Good. And then the next step there would just be showing her ways that we can do hip mobility before and after exercise, especially with the working out and snowboarding, not only for this condition, but as a prevention tool in the future. So if you or one of your friends or family members have any of these conditions, sound familiar, come on in and visit the office here in Towson, Maryland, and hit that subscribe button.
Yeah. All right, toodle.
Hey everybody, it's Mike here with Kalkstein Chiropractic. I've got Tanisha with me. We're doing part 2 of our McKenzie video. So if you didn't see the first video, we were over there on the exercise floor. We were covering the cervical or the neck McKenzie. Just as a quick kind of wrap up, if you will, our McKenzies are a functional movement pattern. Not really as much an exercise as more just a movement kind of pattern or a movement position you can get yourself into that will help alleviate pain in any of your joints that you have. Today's video, we're focusing solely on the low back and on our neck. But again, like I said in the previous video, we have McKenzie's for hips, we have McKenzie's for knees. Pretty much any of your joints, any of your extremities that are bothering you, we can end up doing a McKenzie for in some form of variation. Because ultimately what it is it's movement in the plane that your body is kind of inclined towards disagreeing with. So for today, what we're looking at is a lumbar McKenzie extension would be the full name. This is for somebody who has more of a rounded posture. You know, you work at your desk a lot, you kind of have that natural rounding of your shoulders. That means your body is more prone to liking that flexion, that forward tilt. So what we're going to be doing is we're going to be giving the body some of the movements that it's not really used to throughout the day. So that would be the extension. So kind of opposite of that forward tilt that you might be into from a sedentary job. Now for today, we're going to be focusing our video on the variation that you would more than likely come into the office and receive for your first treatment or exercise day, if you will. And that's going to involve a bar like you can see here in the video. Now, that being said, we want this video to still be informative to those of you who are at the house. So kind of after we talk about it a little bit, I'll show a variation that you can do just with your hands and just standing up tall. I'd recommend using a mirror so you can still see yourself, maybe even filming or using a partner, just so you can make sure you're standing up, correctly, and we'll kind of go over what you should be looking for. But again, today we're going to focus the video solely on using the bar and that at-home variation. But we do have a variation that you can do on the ground as well. So if you want us to do that, in an additional video, kind of cover some more grounds, just go ahead and leave us a comment and that'll be the next video that Tanisha and I here do, okay? So anyways, without further ado, we're gonna go ahead and look at the extension over the bar, a McKenzie 5, as you might hear here in the office. So what we're looking for, and we can kind of position ourselves to the side. Tanisha, take a step forward for me real quick. We want our bumper, our cushion of the bar to be right above where the waistline or where the belt would be. So Tanisha, go ahead and step back in for me, and that's perfect. So now when we're doing this movement, Tanisha is going to go over it kind of at a full speed, but I'll show you what it's going to look like in a kind of half frame at first, if you will. So we're going to be holding the bar at a comfortable position. We're going to begin by taking a deep breath, a nice and full breath. So now as we exhale that breath, we're going to lean about 5 degrees backwards. We don't want to lean too far. We just want to initiate that movement. We're going to take another deep breath. And we're going to exhale and lean back again about another 5 to 10 degrees, and we're going to return to normal. So that was slowed down again. We're in a full-sized, or full sped repetition. We're not going to break it down and hold each position. It's just going to be a nice here, there, and return to normal. That would be a normal speed. So let's go ahead and have Tanisha here model what over the bar is going to look like for us, and we'll go ahead and kind of talk about it as well. So take that first deep breath and exhale, get a little bit of movement. Perfect. So again, this might be just like with the neck, this might be a little bit more movement than you're capable of doing at the house, because again, Tanisha isn't in a lot of pain. This is more a demonstrational purpose. And so Tanisha, just go ahead and keep going through those repetitions just so at home we can kind of see. Anyways, if you're only getting, a 5-degree motion and you're feeling pressure in that low back, kind of right where that bar would be, that's actually exactly where you want to be, and go ahead and return to normal. This shouldn't be like feeling like you're hyperextending, like you're getting a really big stretch. You should just start to feel an initial pattern or initial pause of pressure, and then we're going to come back up. So when we're at the house, obviously it's hard to replicate this. It's hard to get a countertop that's right above where the waistline would be. And so that's why I'm going to go ahead and show the viewers now how we would do this exact movement if we didn't have the bar in front of us. So what we would do is we would place our hands either on the full part of the back or even at the sides, and we're going to just pretend like that's the bar, and we're going to bend straight backwards from our hands, just like Tanisha and I are doing. And again, you're going to return to normal. So Tanisha is going to go ahead and model a couple of those repetitions for us. And I want everybody at home to really focus on making sure that we're standing up nice and tall like Tanisha is. We want to eliminate any of that hunching that we might be doing. And so that's why I said earlier, if you can get a family member, if you can get a friend, or even if you can just film yourself, that's going to be ideal. I want to avoid doing this in a mirror because I don't want you to be hooked to the side the whole time and then worry about getting some neck problems as well. So let's either film ourselves doing this or let's have a friend and let's just make sure our form is okay. Or you can come by to the office. You can always come into Kalkstein Chiropractic. We'll get you taken care of. You know, like I said earlier in the video, we do have plenty of other McKenzies that we can do. I said earlier to drop a comment if you want to do floor McKenzies, but go ahead and drop a comment as well if you have some knees, if you have some hips, if you have anything that you want us to kind of go over in an additional video. All right, guys? Like I said, this is Mike. I got Tanisha with me, and we'll see you next time, okay?
Hello, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor, and I'm with Dave this morning. Dave, how long have you been a client with us?
25 years.
25 years, yeah. And Dave came back in about a week ago?
Yes.
What brought you back in?
Low back pain and tingling in my feet.
Both feet?
Yes.
Yeah. So your journey, you went to your primary, correct, first?
Yes.
Yeah, and she examined you?
She did, and she put me on a steroid pack.
The steroid dose pack?
Yes.
Yeah, with a tapering dose?
Yes.
Yes.
And I didn't get much relief from that.
Okay.
So I called her, then they sent me to a pain doctor.
Right, right.
And he did his examination and decided I needed PT.
PT. So, but he didn't want to give you any epidurals or anything like that, any injections?
No, he said he wanted to try PT first, and
Okay.
then if that didn't work, they'd come back for an injection.
Okay. You came back here over the PT. Why'd you do that?
I've been a client here for 25 plus years, so
Yeah,
it's
yeah. Dave was here last week, and the fellow who referred him, who's been coming here longer than Dave, they both were in the office at the same time.
Yeah.
It was like a reunion for these guys.
One
right?
Duffy,
Yeah,
yes.
yeah. So, did you have an MRI?
I did.
Yeah. So, and what was the pain management? What was your primary care's, if you will, diagnosis? What did they say was wrong?
There was some pinching and some narrowing, I think was the word in the report.
Right. So you had some compression on a nerve or pinching of the nerve, but you also had some narrowing, right?
Yes.
So that's pretty challenging, right? And what I mean by that is the narrowing is called spinal stenosis, and the pinching of the nerve is called radicular pain. And Dave has discomfort down into both legs. And so we did an examination of him. We found some limited range of motion that was really uncomfortable for him. And we found other things too that I don't think you knew about before we did them to you, right? So go ahead and face Carly for me a little bit. And do you have more pain on one side of your back than the other?
Left.
More on the left side. Okay, so let's have you bend to the right, leaning to your right. No, we went through the.
We did.
Dave, he was not in the Marine Corps either. So is that uncomfortable?
Yeah.
Yeah. What side does that bother you on?
Well, right now it's in the middle.
It's right in the middle.
Today.
Now let's go to your other right.
Other right.
Yeah. There you go. Okay. Is that uncomfortable?
Yeah. Yes.
Yeah. Okay. Yeah. Now let's try to do this. Let's put our hands and let's go backwards. Yeah. Is that uncomfortable?
Yes.
Yeah. So step over this way just a little bit so you're facing out that window. And now do the best you can by touching your toes. Just bend forward to your waist. Okay. Yeah, now come on back up for me. Of those two movements, bending backward or forward, which one's worse? Forward. Forward, yeah. So when Dave came in, this is your fourth treatment, right? Correct?
Yes.
And to be honest with you, Dave had decompression, and we did a little bit of this thing called McKenzie. So he's actually better now that he walked in the door, and after just 3 visits, he's even a little better. He could barely get forward like that before he got this grabbing, searing pain, right?
Yes.
Yeah. So we're doing some decompression, and we are doing it's called McKenzie. It's a movement direction, and we're also adjusting him. What I did when I examined him the other day is he had some numbness. When I touched both sides of his leg, especially on the left, he didn't feel that as strong. But more importantly, he had some motor weakness when he, remember that big toe?
Yeah.
Did anyone check that? Did the primary care check that? Did the pain manager check your strength at all like that?
The pain guy.
Yeah. Did he find that though? That weakness?
I'm not sure.
Yeah. So one more time for us. Bend to your right side for me. Yeah. Go ahead to the right. And then go back to the left. Oh, that really grabbed it, doesn't it?
Yeah.
Oh gosh. I'm lucky I didn't lose it. All right, let's get you to lie on your left side down, your right side up, okay? Left side down, right side up. I'm gonna slip your shoes off, okay?
Yep.
Yeah. So bend your toes towards your nose, and I want you to push down hard into my, push hard, come on, good. Bend your toes back towards your nose, back up again. Hold that for me. Hold that for me, come on, be strong. That away. Hold this one. Hold it. Yeah. So come on over here, Carly. I want everyone to see this. He's got some weakness. It's called dorsiflexion, or actually it's called ankle flexion. Bend the toes back again. So when I do this side, when I do this right side, hold that for me. Solid. Hold this one for me. Come on, hold it. It just gives way, right?
Yeah.
So, and that's so obvious. The other way we check for it to see if he has weakness. So this is a big finding, right? It just tells me how much compression's on that nerve.
Okay.
Either from the stenosis or stuff being pushed up against that nerve.
Okay.
So the signal can't get down to the muscle, if you will, right? So stand against that wall for me. The first thing I'm going to have you do is I want you to get up on your heels and try to walk over towards me, okay? try to walk towards me. Do the best you can. Which leg do you struggle with?
The left.
Left one, yeah. Now hold on to that, right? So now go back up on your heels again, right? So stay, resist me. Resist me. Okay. So now let's go back onto the table, all right?
On the back?
Yes, I want the left side down, the right side up. We're gonna go up to the right side first. So this is complicated, right? Because he has a little bit of the stenosis, and that doesn't happen overnight. And he definitely has some compression on that nerve, I think. Very specifically, that S1 nerve, okay? So put this hand up like this. So if you could just let this leg drop.
That felt good.
Huh?
That felt good.
Yeah. You know, it looks like it might be somewhat, no, stay there on your back for me. We're going to do a dog and pony show. The action was pretty comfortable. That was good, right?
Yeah.
Yeah, now stand up for me. And again, face Carly one more time for me. All right? There you go. Okay. All right, now, right is that way. Left is this way.
Do the right first.
Go to the right first. Oh, look at that. Yeah.
Yeah. Much
Okay.
better.
Yeah, much better. Much further, less pain, right?
Yes.
Yeah, let's go this way and see what happens on the left side.
A little better, but
Yeah, still there. Still grabs you, right? Yeah.
Yes.
So let's have you face me this way.
right side this time.
Yeah, correct. Right side down. Oh God, us guys in the Navy, we do our right from our left. You sure you weren't in the Marine Corps?
Is that the dig to the Marines?
It's a dig to the Marines. It's like Army intelligence. That's is there such a thing, right? Okay, now let that go, nice and loose. There it goes. On back for me. Very good. Okay, so let's have some fun. Rest your head down. Bring your toes towards your nose again. I want you to hold this for me. Hold this. Hold, be strong. Come on, hold. Good. Now, bend your toe back up again. Hold this for me. So do it again one more time. Hold that. Bend that back. Hold that for me.
Not much better.
Yeah, see, that's really nice, right? I've done this in the past where I've had people that were of a younger age, and I've adjusted them like that, and their strength comes back like this. He definitely is stronger. Do you feel that yourself? Do you feel it being stronger when I pulled you?
Yes.
Yeah. So that just means I'm getting some pressure off that nerve, right? Yeah. So go ahead and stand up for me.
face.
Yes. Now go to your right one more time.
At the right.
There we go. That's really good.
Oh, yeah.
Now come back the other way. Just come into it slowly. Come on over to it. Yeah.
Yeah, oh, wow, that's better.
Yeah, go stand up for me. Yeah, see, even that movement's better.
Not a lot of pain.
You know, so
I mean,
part,
a lot less pain.
you know, part of the issue is how much of the stenosis is it bothering you? And one of the things we're doing with them is we're doing a McKenzie, and either you go forward or you go backward with McKenzie. We have Dave going backwards. And a lot of times, you know, like it's 70% of the time we're going to go backwards with somebody. 30% of the time we're going to go forward. And the forward people who like going forward, a lot of times will have some stenosis. And I'm not so sure, I mean, you have stenosis, but I'm not so sure that that's what I call the pain generator in your case, right? So a review of low back could be due from a facet joint.
Okay.
It could be due to a strained muscle or ligament, and it could be due to a disc. The other joint component I'll put in there, there's this thing called the sacroiliac joint, right? Yeah. And so joints are facet joints and sacroiliac joint, muscle problems, or disc derangement, a bulging disc, a herniated disc, whatever, right? Yeah. Let's do this before I keep talking. Bend forward for me and see what that feels like for me.
Better, but see that it pulls.
Yeah, that's okay. That's significant. See,
Oh,
when he first came down here, his fingers weren't below his
Right,
thigh. So that's really nice, right? So what we're doing some decompression. All right. So you can check out some of that on our line. The other thing we're having is he's standing up. Go ahead and do one with me. Arch backwards for me now. Yeah.
Oh, that's much better.
1001. Now come back up again for me. Do it again. Breathe in, exhale, all the way back. There you go. Right? That way. Keep your knees straight. Don't bend your knees. I want you to feel that compression back there.
Yeah.
Take the pressure off of it now. So he's not going to go back there and hold that. Do another one more time. Breathe in, exhale, go all the way back. There you go. 1001, 1002. Let the pressure off. Okay. So if you sit for any length of time, more than 45 minutes to an hour, even if you get out of the car, you get up and you do 10, 20 of those until you feel like that pressure's off your back.
Okay.
Do not sit at home on the couch. Did I go over how to sit with that roll there with you?
No.
No. So let's do that real quick here. What we're going to do, we want to ensure that he has this lumbar curve or this lumbar lordosis. So we're going to take this roll, which is also called a McKenzie roll, and we're going to slide it back in there, because when people sit, they slouch, and when you slouch, you put more pressure on the disc, and we don't want that, because that's what's generating the pain, I think, right now, okay? So let's have you have a seat here. Now sit back and drive your femurs back to the back of the chair. Yeah, there you go. Okay, that's how I want you to sit.
Okay.
So when you're driving your car, take that lumbar support and push it out all the way out. So your belly button's going forward, right? Stay off the couch at home.
Okay.
Sit in a chair that has a nice back to it and a nice firmness to it. And you either get one of these, or you can make your own by rolling a towel up, put some rubber bands on it. I like these better, right? Yeah. Okay?
Okay.
Yeah. So this is complicated because he has muscle weakness. We want to get rid of that muscle weakness as fast as we can. So we're probably going to be a little bit more aggressive on how often we see it. Would we see it 3 times?
Yeah, 3 times.
Less. How much better do you feel now compared to you walked in just today? 20% less pain, 30% less pain?
Probably 40%.
40%.
Yeah.
And his movement, your movement's
Yeah, I'm getting
much better, yeah. But we have some work to do. Okay? So your homework at home is these McKenzies all day long.
Okay.
Until you get back in here on Monday, right? So next week we're going to go Monday, Wednesday, Friday.
Okay.
And you can see me or you can see one of the docs in the office.
Okay.
Okay? Yeah. Any other questions?
No, it's
Yeah.
very helpful.
Yeah, that's good. Thank you, Baltimore.